agenda item 7, which is going to be a fairly complex part, quite honestly. First off, I'd like to talk about the social services and the NHS integration. One of the values of the meeting that Julian and I had with Dr. Richardson was to look at what is being done to increase the relationship between the NHS and social services staff so that they are beginning to properly to work together to look at how to save the people who need the care which is semi-social and semi-health. I was in fact impressed, and don't get me wrong because I'm not impressed easily, I can tell you that, impressed by the amount of work that's going on in the background between Dorset County Council Social Services, Adult Services and the CCG in trying to find a formula that can mean that they can work together in a much better integrated way, and also to look at the financial funding problems that are inevitably there. Social services will tell you, Helen Summers, I think it was, who from the Dorset County Council, Helen Coombs will tell you that there's no money. And there isn't, there genuinely isn't. They are stretched beyond measure to cope with the work that they have to do within the community in social care and social services. The CCG, the NHS, has over the years had a slightly additional funding in places to help with this issue, and so have social services over a good many years had extra poured into them. And what is now happening with the CCG is they are looking to see how a great closer use will help reduce things like bed blocking, will help reduce things like the need for individuals to go into nursing care or nursing home care or into protected home care, to try and see if they can increase the opportunity for people to be kept at home, therefore reducing the overall costs. And the overall costs, if they're reduced, will help pay for the integrated system that they've got to work. Now, my guess is that they're 2 years away from introducing this properly. If they can do it within 2 years, I think that they will have achieved what nobody else in the country has yet achieved, so far as I am aware. And that integration, which should have started in 1990, as part of the big thrust to have the people turned from being cared for in small groups in hospitals or whatever into community care. The Community Care Act of about 1990, 1991 has never been fulfilled, and maybe we might see the beginning of that. So I don't know whether you'd like to add anything to that on that particular issue. There were a lot of things that we talked about, and as I say, this was at his invitation, and it was we had spoken about the opportunity to talk. I suppose the first time was in about the beginning of February. And I'd had 1 or 2 conversations, Julian had had 1 or 2 conversations, and we actually went and spent a good hour and a half with him to look at some of the things that they were doing. And Julian has already mentioned that about to be come onto the market properly is a report on a study in transport in Dorset. Now, one of the big one of the big kicks that the CCG received was that in terms of changing the way the care for people in the health service was changing, i.e. distance travel and so on and so forth, to my mind they hadn't properly taken any of those costs or ideas or the worries into account. They have now done so. Whether they can do something major about it or not, I don't know. But they have already commissioned a report with all the major transport operators to see how they can make getting to the centres of health needs in a better and slightly easier way. Please.
Could I ask you which centres of, like you're talking about the acute hospital?
Well, you're talking about getting from here to Dorchester. You're talking about from the west of Dorset into Poole and Bournemouth.
But for North Dorset?
No, I mean, it's a cross Dorset integration plan, and we don't know exactly how that's covered, but we're looking forward to seeing the report.
But the point I wanted to make is that from North Dorset, we generally go to Salisbury.
Yes, sure. No, I understand that. No, I fully understand that. But the moment I'm just sort of concentrating on what's happening across Dorset as a principle, and we'll see what else falls out. I think that they will have to look at the cross-border into Wiltshire needs as a secondary stage to that, and that's a good point. Thank you. So there's that. There's also the issues relating to costs of carers and patients on travel. I think the CCG was knocked back badly on the reaction to their proposals in the way that would affect the community, and it has made them think very hard about some of the things that they are going to put forward. I think that the people who own or who drive cars on the NHS and go from A to B don't realise what the issues are for people who don't have any travel, can't travel by buses and so on. So I think that has been a good kick. It's also, I think it's highlighted the need to look very carefully at how these reorganisations are going to affect individuals in a much deeper way. Now, I think they are, my belief from what I heard from Phil Richardson is that they are looking very carefully at this. And again, it goes back to the point behind the statistics. It's what people said, which they are looking at. Why did they say it, which they're beginning to look at. How much of what people said, as opposed to the statistics, is going to lead their decision making. The other matters, and it's a huge one, this, but it's made me think quite considerably. There's a team in the CCG who are looking at how they reduce the number of patients who are seen within the GP system unnecessarily. And unnecessarily is, could they be seen by somebody rather than a GP to sort out what are minor issues and so on. So not to take away the GP factor, but to reduce the dependency on the GP. And I think that the figure was, if they could reduce the figure by 30%, there were roughly 30% of all GP appointments across the whole country, about 30% fell into a category which could have been dealt with in the pharmacy with the pharmacist and other areas, or with nurses and so on. So they're looking very, very hard at how that might impact on their plans for the reorganisation of the GP elements across Dorset. Now, I think, to my mind, if they can be looking at those as well and reducing, that will reduce costs. It will reduce the burdens on the GPs. It will free up GPs to do more basic needs and so on. It might work, so fingers crossed on that one. And it also might just help on the bed unlocking. I think that's the fundamentals of some of the things that we talked about. Now, I was heartened by the fact that they have groups looking at these specific issues. The first report that he mentioned is coming out next week, which is on transport. The report on issues such as the way that the NHS and the social services are getting together will take a little bit longer, but they've got that now going fairly hardly. And there are other reports. What was he? Can you remember what the other reports he mentioned were? Julie?
I think it was just the two. It was the
Transport.
reduction of reliance on GPs and the transport.
Yeah, I think it probably was. But anyway, that was a substantial amount of talking in that time.